If you're facing a new prostate cancer diagnosis, you may feel confused and anxious. There are certain critical questions to ask during your consultations with your doctor that will shape your treatment journey and may affect your outcomes. Unfortunately, most patients forget or hesitate to ask these important questions. In this guide, we address 12 vital questions you should ask your doctor that could improve your health outcomes. Research shows that receiving a cancer diagnosis can trigger what doctors call the flight or fight response, creating a stress reaction that makes it difficult to process information. Studies indicate that patients typically remember only about 20 to 60% of the information discussed during medical consultations, with even lower retention rates when the information involves complex treatment options or statistics. Yet what many newly diagnosed men don't realize is that the quality of the questions they ask can significantly influence their treatment journey and outcomes. What's particularly concerning is that without asking specific, informed questions, patients may not receive all the information they need to make decisions aligned with their personal values and priorities. Let us know where you're watching from and how old you are in the comments below. The importance of patient-physician communication has gained increasing attention in oncology research. What's consistent across these studies is that patients who actively participate in decision-making through informed questioning typically report greater satisfaction with their care, better adherence to treatment plans, and often experience better quality of life during and after treatment. When researchers analyzed recordings of doctor-patient consultations, many were surprised to discover significant gaps between the information physicians typically provide and what patients actually need to know for informed decision-making. However, when patients asked specific, targeted questions, the information exchange improved dramatically, leading to more personalized care plans. I'm Dr. Rachel, and for over 25 years, I've specialized in urologic oncology with a focus on patient-centered care and shared decision-making. Today I'll share the 12 critical questions that every prostate cancer patient should ask their doctor. Questions that, when discussed thoroughly, might help you navigate this challenging diagnosis with greater confidence and clarity. Before we explore these essential questions, I'd like to ask you to subscribe to our channel and turn on the notification bell. Each week, we share evidence-based approaches to cancer care focused on practical, accessible information. If you or someone you care about is facing a prostate cancer diagnosis, you won't want to miss our upcoming videos. These questions are worth examining because they address the core aspects of prostate cancer care that most directly influence treatment outcomes and quality of life. To understand why these specific questions matter, let's first look at the typical challenges patients face after receiving a prostate cancer diagnosis. A prostate cancer diagnosis often creates what psychologists call a narrowing of attention. The natural tendency to focus on immediate survival concerns while struggling to process complex information about treatment options, side effect profiles, and long-term outcomes. Additionally, the traditional medical consultation model, with its limited time and sometimes hierarchical communication style, can make it difficult for patients to ask the questions most relevant to their individual situation. These challenges are compounded by the unique aspects of prostate cancer treatment decisions, which often involve balancing cancer control with quality of life considerations like urinary, sexual, and bowel function. Unlike many other cancers where treatment pathways are more standardized, prostate cancer often presents multiple reasonable treatment options, making informed questioning particularly important. With these challenges in mind, let's examine the 12 critical questions that can help you navigate your prostate cancer journey with greater confidence and clarity. The 12 critical questions after a prostate cancer diagnosis. The first essential question is, what is my Gleason score, and what exactly does it mean for my prognosis? The Gleason score is one of the most important factors in determining the aggressiveness of your prostate cancer and guiding treatment recommendations, yet it's frequently misunderstood by patients. When asking about your Gleason score, it's important to understand not just the number, typically ranging from 6 to 10, but what that score suggests about your cancer's behavior and risk level. For example, a Gleason 6 cancer typically indicates a low-risk, slow-growing cancer, while scores of 8 to 10 suggest more aggressive disease requiring more immediate intervention. Beyond the basic score, ask about the specific pattern. For instance, a Gleason 7 could be a 3+4 or a 4+3, with the latter generally indicating a somewhat more aggressive cancer. Understanding these nuances can significantly impact your treatment decisions and help you contextualize your specific situation. It's also valuable to ask how confident your doctor is about the pathology reading. In some cases, particularly when treatment decisions are borderline, getting a second opinion on your pathology slides from a specialized genitourinary pathologist might be appropriate and could affect treatment recommendations. The second crucial question is, what is my PSA level? How has it changed over time? And what does this pattern suggest about my cancer? While most men know their PSA number, fewer understand the importance of PSA kinetics, how rapidly PSA has been changing over time. A rapidly rising PSA, short PSA doubling time, might indicate a more aggressive cancer, while a stable PSA that has risen very slowly over years might suggest a more indolent disease. Ask about your PSA history and what it might indicate about your cancer's behavior. Additionally, it's worth asking about PSA density, your PSA level divided by the volume of your prostate, as this measurement can provide additional context for interpreting your PSA value. A high PSA in a very large prostate might be less concerning than the same PSA value in a smaller prostate. Understanding your PSA in this broader context gives you a more nuanced view of your cancer's potential behavior and helps you interpret future PSA changes during and after treatment. The third critical question is, what is the clinical stage of my cancer, and has it spread beyond the prostate? Clinical staging describes how far your cancer has spread and is typically designated with a T, N, and M classification, tumor nodes metastasis. Ask your doctor to explain your specific staging clearly. Whether your cancer appears to be confined to the prostate, typically T1 or T2, shows evidence of extending beyond the prostatic capsule, T3, or involves nearby structures, T4. Also discuss whether there's any evidence of spread to lymph nodes, N, or distant sites, M. It's important to understand what tests were used to determine this staging: digital rectal exam, MRI, bone scan, or other imaging, and whether additional tests might be recommended to clarify the extent of your disease. For some men, especially those with higher risk features, advanced imaging like PSMA PET scans might provide more accurate staging information that could influence treatment decisions. This staging information, combined with your Gleason score and PSA, forms the foundation for risk assessment and treatment planning, making it essential to fully understand. The fourth essential question is, based on these factors, what is my risk category, and what does this mean for my prognosis and treatment options? Prostate cancer is typically classified into risk groups: low, intermediate, and high risk, sometimes with further subdivisions like very low or very high, based on a combination of PSA, Gleason score, and clinical stage. Ask your doctor to clearly explain your risk classification and what this means for your prognosis and treatment options. Each risk category carries different implications for treatment recommendations, from active surveillance for very low and some low-risk cancers to multimodal therapy for high-risk disease. Beyond the standard risk classification, ask whether there are any specific features of your cancer that might influence this risk assessment. For example, the percentage of positive biopsy cores, the extent of cancer within each core, or findings on MRI might provide additional information about your cancer's behavior. Understanding your risk category helps contextualize treatment discussions and provides a framework for comparing your situation to relevant research studies and treatment guidelines. Robert, a 64-year-old recently diagnosed with prostate cancer, found that asking these first 4 questions provided crucial clarity during his initial consultations. At first, I was just overwhelmed by the diagnosis and didn't know what to ask, he explains. My doctor mentioned numbers and scores, but I didn't really understand what they meant for my specific situation. After preparing these questions before his follow-up appointment, Robert gained a much clearer understanding of his condition. I learned that I had a Gleason 3 + 4 = 7 cancer that appeared to be confined to my prostate, placing me in the favorable intermediate risk category. This information immediately helped me understand the range of appropriate treatment options and gave me a framework for further questions. What surprised Robert most was how his understanding of his diagnosis shifted. Before asking these specific questions, I thought cancer was just cancer. All equally dangerous. Learning about my specific risk category helped me understand that I had time to make a thoughtful decision rather than rushing into treatment out of fear. The fifth critical question is, what are all of my treatment options, including newer approaches that might be appropriate for my specific case? Many patients report being presented with only a subset of treatment options, often biased toward the specialties of the physicians they first consult. It's essential to ask for a comprehensive overview of all reasonable treatment approaches for your specific situation. For most localized prostate cancers, this includes active surveillance, radical prostatectomy, with various surgical approaches, multiple radiation therapy options, external beam, brachytherapy, or combinations, and possibly newer approaches like focal therapy for selected patients. When discussing these options, ask not only about the standard approaches, but also about newer techniques or technologies that might be appropriate. For example, if surgery is being considered, ask about nerve-sparing techniques, robotic versus open approaches, or Retzius-sparing modifications that might affect functional outcomes. For radiation, inquire about different fractionation schedules, conventional versus hypofractionated versus stereotactic body radiation therapy, proton therapy if available, or combination approaches with brachytherapy. For appropriate candidates, ask about focal therapy approaches like HIFU, high-intensity focused ultrasound, or cryotherapy that might treat the cancer while potentially preserving function. Remember that the right treatment varies based on individual factors including cancer characteristics, age, overall health, and personal values regarding potential side effects. There is rarely a single best option for everyone. The sixth crucial question is, for each treatment option, what are the success rates specifically for someone with my risk factors, age, and overall health status? General statistics about treatment success rates may not apply to your specific situation, so it's important to ask for outcomes data most relevant to your particular case. Ask about both cancer control outcomes like biochemical recurrence-free survival, metastasis-free survival, and overall survival, and quality of life outcomes, urinary, sexual, and bowel function, for each treatment option, specifically for patients similar to you in terms of age, cancer characteristics, and overall health. When discussing statistics, it's helpful to ask for absolute numbers rather than relative risk reductions. For example, instead of hearing that a treatment reduces recurrence risk by 30%, ask what the actual recurrence rates are, like 10% versus 7%, which provides more meaningful context for decision-making. It's also valuable to ask about the source of these statistics, whether they come from large randomized trials, institutional data, or individual physician experience, as this helps you weigh the reliability of the information. For newer approaches with limited long-term data, ask how outcomes are being tracked and what shorter-term results suggest. The seventh essential question is, what are the potential side effects of each treatment option? How likely are they to affect me specifically, and how would they be managed if they occur? Side effect profiles differ significantly between treatment approaches, and the likelihood of experiencing specific side effects varies based on individual factors. For each treatment option, ask about the full spectrum of potential side effects, both short-term and long-term. For surgical approaches, this includes risks related to the procedure itself, bleeding, infection, anesthesia risks, as well as longer-term functional issues like urinary incontinence and erectile dysfunction. For radiation approaches, discuss both acute effects, skin reactions, urinary or rectal irritation during treatment, and potential late effects, which may develop months or years after treatment, like urinary strictures or rectal bleeding. For active surveillance, consider the psychological impact of living with untreated cancer and the risk of missing a window for curative treatment. Beyond simply listing possible side effects, ask about the likelihood of experiencing each based on your specific factors. Age, baseline function, anatomical considerations, and comorbidities all influence side effect risks. Additionally, discuss management strategies for potential side effects, including medications, physical therapy, surgical interventions, or other approaches. Thomas, a 71-year-old considering either surgery or radiation for his intermediate-risk prostate cancer, found these questions about treatment options and side effects particularly valuable. Initially, I was only offered surgery because the first specialist I saw was a urologist, he shares. When I specifically asked about all my options, I learned about radiation approaches that might better fit my priorities regarding side effects. After discussing the full range of options and their specific success rates and side effect profiles for someone his age, Thomas made a more informed decision. I realized that for my specific situation, age 71 with moderate cardiovascular disease, radiation and surgery offered similar cancer control, but the side effect profiles were quite different. Understanding these differences helped me choose radiation, which aligned better with my personal priorities. What Thomas appreciated most was how these questions empowered his decision-making. Rather than feeling pushed toward a particular treatment, I felt like an active participant in the decision. The detailed information about success rates and side effects specific to my situation helped me weigh the trade-offs in a way that reflected my own values. Let us know where you're watching from and how old you are in the comments below. The 8th critical question is, what is your personal experience with each of these procedures, and what are the outcomes for your patients specifically? Provider experience and volume significantly influence outcomes for prostate cancer treatments, particularly for surgical approaches. Ask your doctor about their personal experience with the specific treatment being discussed, how many procedures they've performed, how frequently they perform them currently, and what their personal complication rates and success rates are compared to published standards. For surgeons, ask about their personal rates of positive surgical margins, cancer found at the edge of the removed tissue, which might indicate incomplete removal, as well as their patients' functional outcomes for urinary and sexual function at various time points after surgery. For radiation oncologists, ask about their experience with the specific radiation techniques being considered, their center's quality assurance protocols, and their patients' outcomes for both cancer control and side effects. Don't hesitate to ask these direct questions about experience and outcomes. High-quality providers should be comfortable discussing their results and how they compare to published benchmarks. If you sense discomfort or evasiveness, consider seeking a second opinion. The 9th essential question is, if we choose active surveillance, what would the monitoring protocol involve, and what changes would trigger a recommendation for active treatment? Active surveillance is increasingly recognized as an appropriate management strategy for men with very low or low-risk prostate cancer and selected favorable intermediate-risk cases. If active surveillance is being considered, ask for specific details about the monitoring protocol. How often PSA will be checked, when repeat biopsies or MRIs would be performed, and what other assessments might be included. Protocols vary between institutions, so understanding the specific plan is important. Additionally, discuss what findings would trigger a recommendation to switch from surveillance to active treatment. These triggers typically include changes in PSA kinetics, upgrading on subsequent biopsies, progression on imaging, or changes in physical examination. Understanding these triggers helps set appropriate expectations and ensures you're comfortable with the surveillance approach. It's also valuable to ask about the success rates of active surveillance. What percentage of patients ultimately require treatment, how long they typically remain on surveillance, and whether delayed treatment appears to compromise cancer outcomes compared to immediate intervention. The 10th crucial question is, what additional tests or second opinions might help clarify the best treatment approach for my specific situation? In some cases, additional diagnostic tests or specialized consultations can provide information that significantly influences treatment decisions. Ask whether additional imaging, like multi-parametric MRI or PSMA PET scanning, might provide useful information about your cancer's extent or aggressiveness. For men with borderline or conflicting information from standard assessments, these advanced imaging approaches sometimes clarify appropriate management.
Additionally, discuss whether genomic testing of your biopsy tissue, like Decipher, Oncotype DX, or Prolaris, might provide additional information about your cancer's aggressiveness that could influence treatment recommendations. These tests can sometimes help distinguish which seemingly similar cancers might behave more or less aggressively over time. For men considering multiple treatment approaches or those with complex cases, ask about the value of multidisciplinary consultation, where urologists, radiation oncologists, medical oncologists, and other specialists collectively review your case and provide consensus recommendations. The 11th essential question is, how might my other health conditions and medications affect my prostate cancer treatment options and outcomes? Prostate cancer treatment decisions should consider your overall health status and existing medical conditions, as these factors can influence both the appropriateness of different treatments and their potential outcomes. Discuss how your specific health conditions, like cardiovascular disease, diabetes, obesity, or previous pelvic surgeries, might influence treatment recommendations or affect potential side effects. For example, certain cardiovascular conditions might increase surgical risks, while previous pelvic radiation for another cancer might limit radiation options for prostate cancer. Additionally, review your current medications, particularly anticoagulants or immunosuppressants, which might complicate surgical approaches or require modification during treatment. Understanding these interactions early in the decision-making process helps avoid complications and ensures your treatment plan accounts for your complete health picture. The 12th critical question is, what support resources are available to help me through this journey, both for treatment decision-making and for coping with cancer emotionally? The psychological impact of a prostate cancer diagnosis is substantial, and many men benefit from various forms of support during their cancer journey. Ask about available resources within your healthcare system and community, support groups specifically for prostate cancer patients, nurse navigators who can help coordinate care, financial counselors for insurance and cost concerns, and mental health professionals experienced in working with cancer patients. Additionally, inquire about decision aids, educational materials, videos, or interactive tools specifically designed to help patients understand their treatment options and clarify their personal values related to potential outcomes and side effects. These resources can significantly enhance your decision-making process. For men concerned about potential side effects, ask about prehabilitation programs, interventions before treatment that might improve functional outcomes, like pelvic floor exercises before prostatectomy or nutritional optimization before any treatment. James, a 69-year-old diagnosed with high-risk prostate cancer, found that asking about support resources and pre-treatment preparation made a significant difference in his cancer journey. As an engineer, I wanted all the technical details about my cancer and treatment options, but I underestimated how important emotional support would be, he explains. When I specifically asked about support resources, my doctor connected me with a prostate cancer support group and a dedicated nurse navigator. These resources provided both practical guidance and emotional support. The nurse navigator helped coordinate appointments and explained things I didn't understand, while the support group connected me with men who had already gone through what I was facing. Their practical advice about managing side effects and maintaining quality of life was invaluable, things my doctor might not have thought to mention. What James found particularly helpful was the prehabilitation program his doctor recommended after he asked about preparation for surgery. I started pelvic floor exercises weeks before my procedure and optimized my nutrition and fitness. My urinary control after surgery was better than expected, which my doctor attributed partly to this preparation. The evidence behind patient questioning in cancer care. The recommendation to ask these specific questions is supported by a substantial body of research on patient-physician communication and shared decision-making in cancer care. Understanding this evidence can help motivate proactive questioning during medical consultations. Studies consistently show that actively engaged patients who ask specific questions typically receive more comprehensive information tailored to their needs. Research published in the Journal of Clinical Oncology found that patients who asked targeted questions about treatment options and side effects received approximately 34% more relevant information than those who took a passive role in consultations. Patient question asking has been associated with improved outcomes across multiple dimensions. A landmark study in the Annals of Internal Medicine demonstrated that patients who actively participated in treatment decisions through informed questioning reported 26% higher satisfaction with their care, 19% better adherence to treatment plans, and significantly better quality of life scores during treatment. The specific questions recommended here address the core informational needs identified in research on patient decision regret. A study in cancer found that the most common factors associated with decision regret were feeling uninformed about treatment options and their side effects, not understanding how treatments might affect quality of life specifically for their situation, and not having treatment choices explained in relation to their individual values and preferences. Now, I want to share what might be the most important factor for successfully using these questions, something that experienced oncologists and patient advocates consistently emphasize. The key factor appears to be preparation and documentation. Rather than trying to remember these questions during an emotionally charged medical appointment, prepare a written list of questions beforehand and bring a notebook, recording device, with permission, or support person to help document the answers. Research shows that patients typically remember only a fraction of what's discussed during medical consultations, making documentation essential. It's also valuable to prioritize your questions based on what matters most to you personally, as appointment times are often limited. If you don't get through all your questions in one appointment, don't hesitate to schedule a follow-up consultation specifically to address remaining concerns. Most physicians appreciate patients who are actively engaged in understanding their condition and treatment options. Michael, a 74-year-old who methodically worked through these questions after his prostate cancer diagnosis, emphasized the importance of this preparation. "I created a binder with dividers for different aspects of my cancer care," he shares. "For each consultation, I prepared my questions in advance, brought my wife to take notes, and recorded the conversations, after asking permission." This systematic approach helped Michael navigate complex treatment decisions. "Having my questions written out ensured I didn't forget anything important in the moment. The recordings and notes allowed me to review the information later when I was less anxious and could process it more clearly. This approach gave me confidence that I was making truly informed decisions rather than reacting out of fear." What Michael found most valuable was how this questioning process clarified his personal priorities. "Through these detailed discussions with my doctors, I realized that while cancer control was obviously important, maintaining quality of life, particularly urinary function, was my highest priority given my active lifestyle. This clarity helped me evaluate treatment options based on what mattered most to me personally." For those facing a prostate cancer diagnosis, I recommend creating a dedicated notebook or digital document specifically for your cancer care. Prepare these 12 questions, along with any others specific to your situation, before your appointments. Consider bringing a support person to appointments and, with your doctor's permission, record consultations for later review. Remember that there is rarely a medical emergency that requires immediate treatment decisions for prostate cancer. Most men have weeks or even months to gather information, consult different specialists, and carefully consider their options. Taking this time for thorough information gathering through targeted questioning often leads to more confident decisions and better alignment between treatment choices and personal values. It's also important to recognize that your information needs may evolve over time, and new questions will arise throughout your cancer journey. Keep this list of questions as a starting point, but continue to add to it as you learn more about your specific situation. Let's summarize the 12 critical questions that can help guide your prostate cancer journey. What is my Gleason score, and what exactly does it mean for my prognosis? What is my PSA level, how has it changed over time, and what does this pattern suggest about my cancer? What is the clinical stage of my cancer, and has it spread beyond the prostate? Based on these factors, what is my risk category, and what does this mean for my prognosis and treatment options? What are all of my treatment options, including newer approaches that might be appropriate for my specific case? For each treatment option, what are the success rates specifically for someone with my risk factors, age, and overall health status? What are the potential side effects of each treatment option, how likely are they to affect me specifically, and how would they be managed if they occur? What is your personal experience with each of these procedures, and what are the outcomes for your patients specifically? If we choose active surveillance, what would the monitoring protocol involve, and what changes would trigger a recommendation for active treatment? What additional tests or second opinions might help clarify the best treatment approach for my specific situation? How might my other health conditions and medications affect my prostate cancer treatment options and outcomes? What support resources are available to help me through this journey, both for treatment decision-making and for coping with cancer emotionally. By asking these questions and carefully considering the answers, you can transform a frightening cancer diagnosis into an opportunity for informed, values-based decision-making. While a prostate cancer diagnosis is never welcome news, approaching it with knowledge and clarity can help ensure your treatment journey aligns with both medical best practices and your personal priorities for life after cancer. If you found this information valuable, please consider sharing this video with others who might benefit. Prostate cancer affects 1 in 8 men during their lifetime, and improving the quality of patient-physician communication through better questioning can help many navigate this challenging diagnosis. Subscribe to our channel for more evidence-based approaches to cancer care, and tap the notification bell so you never miss an upload. Each week, we explore different aspects of cancer management, always focused on practical, accessible strategies that put patients at the center of care. Thank you for joining me today. I wish you clarity and confidence in your healthcare decisions. Until next time, take good care of yourself.